We're calling on every country to act with speed, skill, and clear-minded determination. This is not a drill. This is not the time to give up. This is not a time for excuses. This is a time for pulling out all the stops.
An appeal today from the head of the World Health Organization. He's urging countries to work fast and together to stop the spread of coronavirus, arguing the window for containment has not closed. Welcome to Power and Politics. I'm Vashi Kapelos. Here's a look at where the spread of COVID-19 stands right now. The number of cases worldwide now tops 95,000. More than 3,000 people have died. Cases of the virus have been confirmed in 79 countries. You'll see them all lit up there on your screen. South Africa is the latest to confirm its first case. Here at home, the number of infections has risen to 37, with new cases reported in Ontario and Quebec. BC, of course, is also affected. Prime Minister Justin Trudeau was asked today why Canada hasn't barred entry to foreigners traveling from some of the regions worst hit by the outbreak. Here's his response.
We're going to keep doing the things that actually keep Canadians safe. There is a lot of misinformation out there. There is a lot of knee-jerk reaction that isn't keeping people safe, that is having real challenging impacts on communities and on community safety. We're going to stay focused on doing the things that actually matter.
Meanwhile, more Canadians abroad are in danger of contracting the virus. 235 Canadians are on board a cruise that's being held off the coast of California. That ship, named the Grand Princess, was returning from Hawaii to San Francisco with 3,500 passengers on board. There are reports some passengers and crew have developed symptoms. Everyone on board is being held until they've been tested for the virus. Public Safety Minister Bill Blair joins us from Washington. He also sits on the newly formed Cabinet Committee on the Federal Response to COVID-19. Hi, Minister Blair. Great to see you. Thanks for making time for us.
Hello, Vashi.
Before I get to the reason that you're in Washington, Minister, I want to ask you about the coronavirus and Canada's measures to prevent its spread. Did your American counterpart today express any concern over Canada's approach at the border, which does differ from the U.S.'s?
Actually, no, and we had a very good conversation. Myself and the acting secretary from Homeland Security spoke about the measures that we're both taking, and I think the sharing of information and the collaboration that has always existed between our two countries as we maintain the integrity and the security of our borders is really important. And I explained the measures that we are taking and how effective that they have been. And he explained their position, but there's very good collaboration between us, and frankly, it has not been a concern raised with me as to how we're each managing our border, especially the one between us.
Can I ask you a bit more about the borders, specifically what we've seen so far, at least the information that the federal government has supplied us with? All of the cases have been transmitted through travelers. It's not yet at the community transmission level. The fact that it is so closely associated with travel, is that giving you pause? Are you considering more stringent measures at the border, like we've seen either in the U.S. or a host of other countries? I'm thinking of Australia or Italy or Israel.
Well, let me be very clear. First of all, the illness first rose in Asia, and so the only way it could have come to North American borders was through travel. But we've put in very rigorous screening measures at our airports, and now this week we're also bringing in some additional measures for screening for land, rail, and marine entries into Canada. That screening is proving effective in identifying people that have come from the infected areas, and there have been quite a number of referrals to public health to make sure that the people coming from those areas are in fact screened. If they are in any way symptomatic, that's responded to very quickly, and those individuals are put into isolation and quarantine. And for those who could be at risk, we've also been taking measures with respect to those individuals. And to this point, our containment efforts have been certainly as successful as those undertaken in other countries. We know, for example, as you indicated, in the United States, in Australia, in New Zealand, and a few other places, they've actually put in travel restrictions and barring people from coming from those countries. We have, frankly, I think, a very robust system of screening for individuals coming from those places, and so that everybody who arrives, for example, from the affected area in China is subject to rigorous screening by our border officials and referrals to the public health officials, and that has proved to this point to be an effective measure of containment with respect to this illness.
Do you think those countries, and you use the example of Australia, they're the most recent ones to announce it, they've said that if you've been in mainland China, Iran, or South Korea, you're not allowed in Australia for 14 days from the time that you leave those countries. Do you think that's the wrong decision?
Well, and no, and one of the things I will not do is criticize the decisions made by others on how they are attempting to contain this, but we are working very closely with them.
Why isn't it the right decision for Canada?
Well, for a number of reasons. I think our ability to because of our relative isolation in the world and the fact that there are only a very limited number of flights coming from the affected areas, the screening measures that we've been able to put in place at the airport and with our public health officials has proven to be a very effective response. But at the same time, I'm very respectful of the measures that the Americans or the Australians have put in, which are right for their environments. We're working very closely together, and there is an appropriate level of information sharing, and I think that can be reassuring to Canadians. The steps that we have taken to this point have been effective and appropriate for in the Canadian context. And we're continuing to monitor that very carefully. But our success at containing this illness and keeping it out of our borders has been every bit as successful as those who have undertaken different measures. And so I think it's important to recognize what we put in place was based on our own capabilities, the experience of travelers coming to Canada and where they come. There's only 3 airports, essentially, where people were coming directly from China, for example, in Vancouver, Toronto, and Montreal. And so we were able to put in very rigorous screening methodologies there with our border security agents and with strong support from public health officials right at the airport working with our people. That has been very effective in identifying those individuals who were at risk or who had been affected, and then they were moved very quickly into a treatment facility and isolated to stop further spread of that disease.
There are more than 200 Canadians on a cruise ship off the coast of California that's being held for coronavirus testing. Does the government have any plans to evacuate those Canadians as you did for those who were stuck in Wuhan and on the Diamond Princess in Japan?
I had some conversation today with the Acting Secretary of Homeland Security, and they're making arrangements for the testing of people on that ship, and so that work will proceed with that ship offshore, and then we will do what is necessary to protect the best interest of those Canadians. We are working very closely with the American authorities. I think we've learned a great deal from the experience of both the ship that docked in Yokohama and the one in Cambodia. Those lessons will all be learned, and we will do what is necessary to protect Canadians' interest and Canadians' health and safety on that ship and right across Canada.
Does that include evacuating them if they test positive?
Well, it really depends on the results of that testing, and so I'm not going to get ahead of that, but I am very satisfied with the excellent work that the U.S. authorities are undertaking in Oakland to make sure that those people are in fact tested. And if it turns out that virus is right now present on that ship, we'll do everything necessary to keep the Canadians involved safe.
As the number of coronavirus cases in Canada rises, so too does pressure on the federal government. It appears to do more to stop the spread. What are its options? How are other countries around the world responding to the outbreak? Some are taking more drastic measures than others. Italy is one of the hardest hit nations. Across the country there, schools are closed, and the government ordered all sports events have to be played, minus the fans. In the country's north, an estimated 100,000 people are under quarantine. More than 100 people have died from the coronavirus in Italy, and 3,000 cases have been confirmed so far. Australia has cracked down on its borders. Foreign nationals who have been in mainland China, Iran, or South Korea are not allowed into Australia for 14 days from the time they left those countries. People traveling from Italy will undergo enhanced screening, and there are more than 50 confirmed cases in Australia. Israel has also banned foreigners, but from 8 coronavirus hotspots, and citizens arriving from hard-hit areas will have to enter a 14-day isolation. Events that were to convene more than 5,000 people have been canceled. Israel has reported 16 coronavirus cases. Just south of us in the U.S., there is a ban on travel related to Iran and an advisory telling Americans not to travel to Italy and South Korea. Anyone who's been in China in the last 14 days requires screening. There's 162 cases confirmed in the U.S. and 11 deaths. Finally, here in Canada, the government is urging Canadians to avoid all travel to Iran and avoid non-essential travel to China and Northern Italy. Lower-level advisories have been issued for Hong Kong, South Korea, Japan, and Singapore, and enhanced screening has been added to airports. Canada is also advising travelers from China's Hubei province or Iran to limit contact with others for 14 days and to contact their public health authority within 24 hours of arriving in this country. So, is the federal government doing enough in its response to the outbreak? Stephen Hoffman is the director at the Global Strategy Lab, an organization that advises governments and public health organizations around the world on global health threats. He joins us from Cambridge, England. Hi, Professor Hoffman. Nice to see you. Thanks for your time.
Hello.
When we're talking about the federal government's response, they have answered questions about whether it's enough by saying, and we had the Minister of Health on yesterday, for example, by saying that this disease isn't necessarily going to be contained at the borders at this point, given what we've seen where the outbreak is concerned. What is your evaluation of Canada's response so far?
Canada's response has actually been fantastic in the sense that it's measured, it's proportionate, and it's based on the best available research evidence. I think during any outbreak, there's always a call to do more, yet in a very counterintuitive way, it actually can be harmful when governments overreact because it can actually undermine the public health response. So in that respect, we have seen actually a model response from the Canadian government that it would be better if there were other countries around the world that were following Canada's lead.
When you say that it could undermine the public health response, what specifically do you mean by that?
Well, one example of an overreaction is the enormous number of travel restrictions and bans that we're seeing from dozens of countries. These kind of responses, on one hand, might seem like they could work. I mean, there's this notion about better be safe than sorry. The challenge is travel restrictions don't work. So when people want to travel, they find a way to do so. And actually, it's much better for a public health response if we know where people are traveling and if they do so through official channels, so that if someone does have COVID-19, they can be quickly identified, and those who've come into contact with them can also be identified and then quarantined. The challenge is once we start to impose travel restrictions, sort of carte blanche, what that means is it actually disincentivizes other countries from starting to report when they have cases. Because what country would want to report a case only to be slapped with an illogical travel restriction that doesn't work and that undermines the ability for health professionals to get their medical supplies to be transferred? So overreaction actually can be even more deadly than the virus itself.
What about, and I take your point completely on that, but for example, here we've seen a lot of the cases associated with travel from Iran. Is there a case to be made, not necessarily for banning or closing borders, but, and I know there are some heightened measures in place, but for increasing advisories or for, really, really stringent screening? Like, does any of that stuff work?
Well, the response that the Canadian government's taking is exactly the response that every country should be taking, which is to amplify good public health messaging, such as for those who are returning from areas that have been affected by COVID-19, people should be self-monitoring for flu-like symptoms. And if people develop those symptoms, they should definitely be in contact. They should be calling their healthcare providers, or if they don't have one, to call their local public health unit. The idea of sort of banning all travel from countries, it doesn't work. It's counterproductive. And actually, in this case, it would be illegal under international law. There is an international health regulation, which is what governs how 195 countries around the world are supposed to respond to outbreaks like this one. And imposing travel restrictions are only allowed when they're based on science or a recommendation from the World Health Organization, which in this case has actually recommended against them. So the kind of advisories we're seeing from the Canadian government for people to monitor and for people to make good choices about traveling abroad or when people come back, that's exactly what we want to be seeing governments around the world doing.
Okay, thank you so much. I really appreciate your time, Professor Hoffman, this evening.
Thanks for having me.
That's Stephen Hoffman with the Global Strategy Lab. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.